Chronic kidney disease is an exceptionally common condition with nonspecific symptoms that develop slowly over time. Diabetes and high blood pressure are the two most common causes of the disease in adults. The kidneys filter waste and excess fluid from the blood to be excreted through urination. When chronic kidney disease, CKD, is not properly managed in the early stages, kidney function will gradually degrade and eventually develop into chronic renal failure, known as uremia. Kidney patients may experience edema, fatigue, anemia, oliguria, or lack of urine production. CKD may also be accompanied by high blood pressure, heart disease, and stroke, and may result in premature death. In the later stage, dialysis treatment or kidney transplantation is required. The CDC estimates that more than 1 in 7, or 15% of U.S. adults are living with CKD, with as many as 9 out of 10 unaware of their condition. Moreover, about 2/5 of adults with severe CKD do not know they have it. Causes of CKD: diabetes, hypertension, glomerulonephritis, inflammation of the tiny filters in the kidneys, interstitial nephritis, inflamed kidney tubules, polycystic kidney disease, cysts, long-term urinary tract obstruction, such as enlarged prostate, kidney stones, and cancerous tumors, drugs that cause nephropathy, deterioration of kidney function. Stages of CKD. Glomerular filtration rate, GFR, is a functional index that indicates how good the kidneys are at filtering waste from the blood and can reflect the degree of damage to the kidneys. The National Kidney Foundation divides CKD into 5 levels of severity based on the GFR value. Stage I, GFR greater than 90, normal kidney function. Stage 2, GFR equals 60-89, mild damage to the kidneys. Stage 3, GFR equals 30-59, moderately impaired renal function. Stage 4, GFR equals 15-29, kidney function is severely impaired. Stage V, GFR less than 15, kidneys cannot function normally, uremic symptoms appear, and hemodialysis, a treatment to filter wastes and water from the blood, may be needed. Treatment of CKD focuses on slowing the progression of kidney damage, which is usually achieved by controlling the causes. In that respect, what special care should people with kidney disease take in their daily diet? 1. Salt. People with CKD should control the intake of 3 kinds of salts: sodium, potassium, and phosphorus salt. 2. Vegetables. People with kidney problems or those who are worried about kidney problems should choose low sodium, low potassium, low phosphorus, and nutritious vegetables, such as cauliflower, radish, daikon, shiitake mushrooms, cabbage, garlic, red pepper, etc. 3. Fruit. Red grapes, pineapples, blueberries, and cranberries are all low in phosphorus, sodium, and potassium, yet rich in anthocyanins, as well as a variety of antioxidant and anti-inflammatory substances. They are good for kidney disease patients, including patients with urinary system infections. 4. Protein and fat. When choosing edible oil, olive oil should be the number 1 choice, as it is rich in essential fatty acids and is anti-inflammatory. In addition, deep sea bass is a nutritious source of protein and fat, as it is rich in omega-3 fatty acids that help protect the kidneys and reduce inflammation. 5. Other foods. Buckwheat is nutritious and gluten-free, great for people with CKD. Bulgur, crushed wheat, is also a nutrient-packed grain, a healthy addition to the diet. The watching, interacting, and participation of any kind with anything on this page does not constitute or initiate a doctor-patient relationship with verypudic.com. None of the statements here have been evaluated by the Food and Drug Administration, FDA. The products of verypudic.com are not intended to diagnose, treat, cure, or prevent any disease. The information being provided should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this page or on any other medium of any kind associated with, showing, or quoting anything relating to verypudic.com in any way at any time, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply either the views and opinions of verypeudic.com, others appearing and are protected under the First Amendment. Verypeudic.com promotes evidence-based natural approaches to health, which means integrating her individual scientific and clinical expertise with the best available external clinical evidence from systematic research. By individual clinical expertise, I refer to the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. Verypeudic.com does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of any multimedia content provided. Verypeudic.com does not warrant the performance, effectiveness, or applicability of any sites listed, linked, or referenced to, in, or by any multimedia content. To be clear, the multimedia content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in any website, video, image, or media of any kind. Verypeudic.com hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the content, which is provided as is, and without warranties.